Hello everyone, welcome to today's video. So NEET PG and INIS results have just come out, and congratulations to all of those who have gotten a good rank and are planning to join a residency soon. In this video, I want to talk to you about how to choose a medical specialty now that you are in a situation where you can choose a medical specialty, and take this decision very wisely because your branch is going to be with you for the next 3 years and probably your lifetime as well, right? So take this informed decision, talk to seniors, talk to people, watch videos on YouTube, have an informed decision. What are you going into? So, just a brief introduction about me. I am Dr. Rishabh Jain. I have done my MBBS from AIIMS New Delhi, and I did my post graduation in MD Radiology from PGI Chandigarh. Back in my entrance days, I secured a rank 4 in AIIMS PG and a rank 11 in PGI Chandigarh, and I subsequently did my residency from PGI Chandigarh, and I'm currently a senior resident in radiology at AIIMS Delhi. Right. So first of all, whenever you are looking to choose a medical specialty, first, if you're passionate about a branch, choose it. So I would say the first thing is, if you like a branch really well, I know seniors, I have known juniors who have said at rank 1 that they'll choose ophtha, at rank 1 they'll choose surgery. So if you're passionate about a particular branch, choose it irrespective of what other people are saying, because if you're passionate about a branch, you'll really do well in that branch likely. If you are not so passionate about a particular branch, you are open to a lot of branches, you are open to a lot of choices. So first thing is to rule out branches that you want to do, that you don't want to do, right? Ruling in is taking a branch is a little difficult, but ruling out certain branches are easier. For example, I never wanted to take dermatology, I never wanted to take psychiatry, ENT or ophtha. So I had ruled out such branches, but it was easier for me to take other branches in my preferred institute. So it was easier for me to make that choice that way. Once you have ruled out certain branches, the other thing is to rule in branches that you want to do. Now, this decision can be based on many factors, one of them being early settlement versus late settlement. So when do you want to settle? What is your financial situation back at home? Where do you want to settle? Like in your hometown, in tier 1 cities, tier 2 cities, tier 3 cities. Based on all these scenarios, either you want to settle late or you want to settle early, or you're fine with settling a little late, because surgical branches, as you all know, tend to have a long learning curve, especially surgeries like plastic surgeries, like neurosurgeries, like GI surgeries. These are specialized surgeries. They do pay really well, but it takes a little longer time to settle down there, right? So it is a personal choice based upon your personal circumstances as well. The second thing is definitely work-life balance, right? Because you will be in your 30s by the time you complete your DMs, and so your family will start growing. Okay, you'll get married, you'll likely have a kid by the time you're doing MCH and DM. So you will need to take out some time for family as well, and for your own personal enjoyment as well, right? I mean, we have studied all our lives. Why not to enjoy the life that we are living in, right? So definitely take into consideration some work-life balance as well. Now, earnings is one thing. Obviously, everyone wants to earn well. They have worked really hard for it, and earnings definitely everybody considers while taking a residency. In general, surgical residencies pay much more. Surgical branches pay more than medical branches, and I would go on to say that even surgical branches pay more than radiology or dermatology jobs. But in general, surgical branches are a little hectic work-wise. They have a little late settlement. So it is a trade-off in between all these factors, right? The fourth thing is job satisfaction. Now, this is something that is inherent, and this is something that will live with you for the rest of your life. Like, you are spending around 10 to 12 hours in the hospital or your clinic. So it is natural that you should enjoy the work that you are doing. Okay, so job satisfaction is definitely a very important consideration as well. Now, something that I consider very near to me is my me time. Okay, so I have never been a guy who wanted to work all day, who wanted to just excel in academics or professionally. I have a lot of value to my me time, what I am doing in my free time. So radiology works really well for me because I get a lot of me time to do things that I want to. For example, this YouTube channel, right? I think it was possible for me because I was in a residency like radiology. Now the fifth thing is definitely the chances of going outside India to maybe settle or pursue higher studies. So radiology is one branch that I felt in which it is easier to go abroad, like let's say US, even after your residency to settle down. It is easier to get fellowships in medical branches, in radiology, and so those branches are easier if you want to move to the US, for example, after your residency. Little hectic, little difficult in surgical branches after residency, because you have to again repeat the whole process of doing a residency in US, and getting a surgical residency in US is much more difficult than getting a medical residency in the US. Now after you have made a choice that you can do these branches, the next thing is to tabulate those branches. So the branches that you are interested in versus the institute that you are okay with going to. Now there's a big debate that, and a lot of people agree that branch is much more important than institute, and I agree to that. But I'd like to make a modification that branch is more important than the institute up to a limit. Both of them are important equally, maybe 60-40 I would say, but institute is definitely not a very low priority. Now for a lot of students, what they do when they fill form for counseling, like if they are interested in medical branches and medicine in general, so they would fill in, let's say, AIIMS Delhi to AIIMS BB and after that start AIIMS Delhi Pediatrics and then AIIMS Delhi BB and then let's say AIIMS Delhi Psychiatry and then AIIMS BB So I would not suggest you to do counseling like that. Make a list of choices of branches and the institute that you are willing to go. For example, if you are fine with going to institutes like AIIMS Delhi, AIIMS Jodhpur, Rishikesh, Bhubaneswar, and not fine with going to some other peripheral AIIMS, so make these 4 AIIMS as your choice, and among these fill medicine first in these 4, then pediatrics first in these 4, or likewise AIIMS Delhi Medicine, AIIMS Delhi Pediatrics, AIIMS Delhi AIIMS Jodhpur Medicine, AIIMS Jodhpur Pediatrics. So a mix and match, but you should be fine with both the institute and the branch and not just one of these. Okay, the combination is important rather than each, in my opinion. Now after you have finalized the branch, or not finalized, sort of tabulated the branch and the institute that you're fine with, the next thing is to make a table about each branch as well as institute regarding what are the working hours in that residency, how is the department or the institute toxic. Now this is one important factor or one important pointer that a lot of students don't take up very seriously, but believe me, mental health during residency can rapidly deteriorate and you can quit residency in that subject if you are not enjoying, or if the department is very toxic, right? So definitely take into account the toxicity of the branch in general and the institute as well. Talk to your seniors who are there in these institutes. Talk to some YouTube students who give interviews on YouTube, have written answers on Quora, or some of your seniors who might be there. The city where is that institute located, whether it is a very tier 3 city with no activity around to do after work, or it is, let's say, metro like Delhi, Bombay, Bangalore, right? Now the hands-on, especially true for surgical branches, because hands-on is something that you should know after you finish your residency. Like 3 years after surgery, 3 years after orthopedics, you should know to do basic surgical procedures. And hands-on is something that you can definitely get to know from the pass outs of that institute. Academics. Now academics are definitely important, especially if you want to pursue higher studies like DM and MCH, because a lot of the questions that are asked in these entrance exams get covered during your MD academics, right? So academics I've kept a little lower down in the priority list, but a good academic institute obviously builds up a very good knowledge base. And finally, whether you want to do a DM or MCH in the branch. Now if you take up medicine or if you take up general surgery, chances are that you will go for a super specialization. So ask whether your residency allows some time to study during MD, and what are the chances of getting into interviews of, let's say, central institutes like AIIMS. Now if you have finalized that, okay, this is the branch and I want to do these branch in these institutes, a good idea in my opinion is to visit these institutes personally. Like I went to SMS Jaipur to inquire about the radiology program there because I was getting radiology through NEET PG in my counseling days. So it is a good idea to actually go to the institute, see the institute, how the machines are there, how the residents are working, what are the working hours there, what is the infrastructure and all, right? And finally, don't talk to a lot of seniors, don't talk to a lot of people because it will just create confusion in your mind. So as people say, too many cooks spoil the broth, and it is a very good saying, especially when you are considering a branch, because I know it is a very tough decision to make at this point, and a lot of students are anxious that this branch is going to be with me for the rest of my life. Let me not make a bad choice, and I totally sympathize with you. Now, the question to ask about a branch when you go and visit a senior or talk to a senior is, first of all, ask them what is the schedule breakdown of my rotations during my 3 years. So basically, how my 3 years of residency look like. Where will I be posted for how many months? First year, how is it like? Second year, how is it like? How many months in emergency? How many months in the ward? What are the rotations in, let's say, cardiology, neurology, etc. If you are thinking regarding radiology, how many months of posting do I get in CT, in MRI, in DSA, in ultrasound, in X-ray, etc. So which are the hectic postings, which are the light postings, how is the thesis in that institute? So whether the professors are whether the department is very strict about thesis or it is a little relaxed about thesis, because thesis is one thing that will hurt you when you are doing your residency. Okay, people don't want to do thesis because it is a pain in the ass, to be frank. Now the consultants, whether there is toxicity in the department, or the consultants are very friendly, they are approachable, because you will be a junior in the department, right? And it will be hard for you to approach a consultant. And finally, academics and research. Again, I have kept it lower down in the priority list because these things come after you have done your routine clinical work, you have come to the department, done the routine clinical work and learned stuff, right? Now, again, I've said that certain branches have early settlement, certain have late settlement. In general, medical branches have a little early settlement, and surgical branches, because you need to hone up your skills, they take a longer time to settle. Earnings, more than surgical branches have more earnings definitely than medical branches in general. I would say radiology and dermatology fall in between the two. Both of them have good earnings, not as high as I would say surgical branches if you are talking salary wise. But even radiology, derma have good earnings. So derma, I think, has good earnings in private practice. The jobs per se are not very high paying in dermatology, but no dermatologist does only jobs when he takes up dermatology. So most of the dermatologists are associated with the hospital and they have their own clinic. And similarly for radiologists, most of the radiologists work in a center or in a hospital and they have their own ultrasound clinic sort of thing. But with rest assured, whichever branch you take an informed decision about it, okay? Because a lot of students quit their residency, let's say 3 months or 4 months into residency, and the first 6 months of residency, let me tell you, you'll hate whichever branch you're taking, okay? Because you are new to that branch, the work suddenly increases to a lot, and you're not used to such high intense work. So first 6 months, take it that you're going to hate whichever residency you are joining. But before that, take an informed decision before joining that residency. And once you take it, do not look back. There is no branch which is full of roses, even radiology, I would say. And all branches are important. They have their importance in the medical field. So rest assured, you will do well if you put in effort and dedication in that subject. So I hope this video is helpful to you. All the best for your counseling.